You may feel perfectly fine, but your heart could be under daily attack. High blood pressure is called the silent killer, and for good reason. Today we'll break down what it does to your heart, how to spot the danger, and how to fight back. Right now, nearly 1 in 2 American adults has high blood pressure, many without even knowing it. It doesn't cause sudden pain or dramatic warning signs. Instead, it quietly damages your arteries day after day, making your heart work harder until one day it simply can't keep up. This ongoing pressure leads to heart attacks, strokes, kidney failure, and even vision loss. In fact, hypertension is one of the leading causes of premature death worldwide, and in the US it contributes to nearly 500,000 deaths each year. The scariest part? It often shows no symptoms until it's too late. But here's the good news. High blood pressure is one of the most preventable and treatable health threats, if you know what to look for and act in time. In this video, we'll start by explaining exactly what hypertension is and why even slightly elevated blood pressure can strain your heart. You'll learn how that constant internal pressure damages artery walls, forcing your heart muscle to thicken and eventually weaken. We'll uncover how it silently increases your risk of heart failure, backs you with irregular heartbeat and heart attacks, even when you feel perfectly normal. More importantly, we'll walk you through the early warning signs that are often overlooked, such as unexplained fatigue, mild headaches, or shortness of breath. Then we'll dive into practical science-backed strategies to get your numbers down, naturally and with medical support when needed. From what you eat, how you move, and when you rest, to the tests you should ask your doctor about, this episode is your essential guide to protecting your most vital organ, your heart. If you care about your heart or someone else's, don't miss this. Like this video to help more people discover the truth about high blood pressure. Subscribe to Senior Health Source for powerful health tips backed by science. And please share this video with a loved one. A simple click could save a life. Let's start by answering the most basic but most misunderstood question. What exactly is high blood pressure? Imagine your arteries as flexible garden hoses and your heart as a powerful pump. With every heartbeat, it sends blood surging through those arteries, delivering oxygen and nutrients to every organ in your body. Now think about what happens when that pressure gets too strong, not just once, but over and over again, day after day. That's high blood pressure. It's not a one-time spike. It's when the force of blood pressing against your artery walls stays too high for too long, gradually wearing them down like waves eroding a shoreline. In medical terms, we call this hypertension. You've probably heard your doctor say something like 120/80 or 140/90. But what do those numbers actually mean? These two values are known as your systolic and diastolic pressure. The top number, systolic, measures the pressure when your heart beats and pushes blood out. The bottom number, diastolic, measures the pressure between beats when your heart is at rest. Together, these numbers give us a snapshot of how hard your heart is working to push blood through your body. So what's normal? A healthy blood pressure is usually under 120/80 mmHg. Elevated blood pressure is when the top number falls between 120 and 129 and the bottom number stays under 80. Stage 1 hypertension begins at 130/80 and stage 2 kicks in at 140/90 or higher. And here's the kicker. Many people have no idea their blood pressure is elevated. Why? Because high blood pressure doesn't hurt. It doesn't cause a rash or swelling or make your skin change color. You can feel totally fine and still be in danger. That's why it's earned the nickname, the silent killer. It creeps in quietly and does its damage without you realizing it, until something serious happens like a stroke, heart attack, or kidney failure. Let me share a real story. A man named Greg, 52 years old, worked a desk job, didn't smoke, and thought of himself as relatively healthy. He rarely went to the doctor, felt no chest pain, no dizziness. Then one morning he woke up with numbness in his left arm and slurred speech. He was having a mild stroke. At the hospital, his blood pressure was 176/98. Greg had stage 2 hypertension, completely undiagnosed. He was shocked. But Greg isn't alone. In fact, over 122 million adults in the US, that's nearly 1 in 2, either have high blood pressure or are on the cusp. That includes millions of people in their 40s, 30s, even late 20s. It's not just a senior problem anymore. One reason this condition flies under the radar: symptoms are rare. Unless your numbers skyrocket, you might not feel a thing. No pounding headaches, no warning lights. That's why routine blood pressure checks are so critical. The only way to know for sure is to measure it. At your doctor's office, a local pharmacy, or even at home with a digital monitor. Another reason people ignore it? Misconceptions. Many assume I eat okay or I'm not overweight so I must be fine. But hypertension isn't just about weight. It can be triggered by genetics, stress, poor sleep, too much sodium, alcohol, even certain medications. You could be active and thin and still have high blood pressure. Just like Greg. And here's something else that's crucial to understand. Blood pressure tends to rise with age. The elasticity in your arteries gradually weakens, making it harder for them to manage pressure. That's why checking it regularly becomes even more important as you get older. Now, here's where the good news comes in. High blood pressure is manageable and even reversible in many cases. But first, you have to know it's there. So what can you do right now? Check your numbers. Get a baseline and track it over time. Talk to your doctor about your risks, and watch the rest of this video series because we're going to walk you through the exact ways high blood pressure harms your heart and what you can do to fight back, starting today. Because your heart isn't asking for much, just a little awareness, a little action, and the courage to face something silent before it becomes deadly. Now that we've uncovered what high blood pressure really is, let's talk about the quiet destruction it causes inside your body, especially to your heart. It doesn't happen overnight. There's no sudden explosion. Instead, it's like a slow, relentless pressure pushing against your most vital organs, day in and day out. And your heart? It takes the biggest hit. Let's break this down. Imagine your heart as a hard-working engine. Under normal conditions, it beats around 100,000 times a day, pumping blood through arteries that offer just the right amount of resistance. But when your blood pressure is high, those arteries become narrower, tighter, and stiffer. Your heart has to push harder, like trying to blow air through a pinched straw. And when that happens for weeks, months, or years, the heart begins to thicken. Specifically the left ventricle, the chamber responsible for pumping blood to the entire body, starts growing larger and more muscular in response to the increased workload. This condition is known as left ventricular hypertrophy, LVH. At first glance, it might not seem like a bad thing. Bigger muscles, stronger heart, right? Wrong. Just like a bodybuilder's muscles can become stiff and bulky, the enlarged heart muscle becomes less flexible. It has a harder time filling with blood. And over time, this once strong heart begins to weaken. It loses efficiency. It struggles to keep up. This is one of the major pathways to heart failure. Let me tell you about Sandra, a 61-year-old schoolteacher from Ohio. She never felt sick, but her blood pressure was consistently in the 150/95 range, sometimes higher. Over the years, she developed fatigue and swelling in her legs. She couldn't climb stairs without stopping. Her diagnosis? Heart failure with preserved ejection fraction, a condition strongly linked to untreated hypertension and left ventricular hypertrophy. Sandra's heart was simply overworked and now exhausted. But it doesn't stop there. When your heart is under chronic strain, its electrical system can start to short circuit. This can trigger arrhythmias, abnormal heart rhythms that disrupt how your heart beats. The most common one? Atrial fibrillation, or AFib. A chaotic rhythm in the upper chambers of the heart. People with AFib often experience heart palpitations, lightheadedness, or even blood clots that can lead to strokes. In fact, high blood pressure is one of the leading causes of AFib, and AFib increases stroke risk 5-fold. That's not a small number. Now let's zoom out beyond the heart. Your arteries, the highways of your body, take a beating under high pressure. Over time, the constant force can tear the inner lining of artery walls, allowing fatty deposits to build up. This condition is called atherosclerosis. It narrows the vessels, restricts blood flow, and creates the perfect setup for heart attacks and strokes. Here's a frightening stat. More than half of people who die from heart disease had high blood pressure, and many didn't know it or didn't take it seriously until it was too late. But the damage doesn't end with the heart and brain. High blood pressure is like a wrecking ball for your entire circulatory system. In your kidneys, it damages the tiny blood vessels that filter waste. Waste. Over time, this can lead to chronic kidney disease or even kidney failure. In your eyes, it can cause hypertensive retinopathy, leading to vision problems or even blindness. And in your brain, it weakens small vessels, increasing the risk of mini strokes, TIAs, or vascular dementia, a condition where poor blood flow starves brain cells and impairs memory. All of this from something that often has no obvious symptoms. That's why blood pressure is so deadly. It doesn't make a dramatic entrance, it works quietly, silently, until suddenly it doesn't. The good news? It doesn't have to be this way. High blood pressure is not a life sentence. It's a wake-up call, and it's one you can answer. We've just explored how high blood pressure silently damages your heart and organs. But here's what's even more alarming. Most people don't feel a thing. That's why doctors around the world call it the silent killer. It creeps up on you slowly, invisibly, day after day, without causing any obvious symptoms, and by the time it starts making noise, serious damage may already be done. Let me tell you a story. Mark was a 52-year-old father of 2 from Texas. Healthy eater, walked his dog every morning, never smoked, he wasn't overweight, he felt fine. But one afternoon at work, he stood up and suddenly felt lightheaded. A trip to the clinic revealed his blood pressure was 178, 1 of 6. He had no idea. He hadn't had a checkup in 3 years. And what the scan later showed was early signs of left ventricular thickening. His heart had been working overtime quietly for years. Unfortunately, Mark is not alone. According to the CDC, that 1 in 3 American adults with high blood pressure don't know they have it. That's tens of millions walking around with a ticking time bomb in their chest. Because the early warning signs are often so subtle, they're easily brushed off as just being tired or getting older. So what might these subtle signs look like? Let's break them down. 1. Headaches. It's one of the most common yet misleading symptoms. Most people don't associate a dull morning headache with a heart risk, but in some cases, especially when blood pressure is extremely high, what we call hypertensive crisis, a persistent headache, often located at the back of the head or pressing behind the eyes, can be your body's way of waving a red flag. But here's the catch. Most people just grab a painkiller and move on. They don't check their BP. That's where the danger lies. If you're waking up with headaches a few times a week, don't assume it's stress. Get it checked. 2. Fatigue. We all feel tired now and then, but when your blood pressure is high, the heart has to work harder to pump blood to vital organs, meaning your body may be running on low fuel even if you're at rest. If you find yourself unusually tired after simple tasks like walking upstairs or carrying groceries, or if you just don't feel refreshed after a full night's sleep, it could be your cardiovascular system telling you it's under pressure. A 2018 study in the Journal of Human Hypertension found that patients with uncontrolled hypertension reported significantly more fatigue than those with healthy blood pressure. 3. Vision problems. Yes, your eyesight can take a hit from high blood pressure. Elevated blood pressure can damage the tiny fragile blood vessels in your eyes. This can cause blurred vision, floaters, or even temporary vision loss. It's a condition called hypertensive retinopathy, and it often goes unnoticed until an eye doctor catches it during a routine exam. Dr. Sarah Reynolds, a leading ophthalmologist, once said, "The eyes are often the first place we see vascular damage. I've diagnosed high blood pressure in patients who had no idea just by looking at their retinas." So, if your vision has been off lately, or you've had sudden changes, don't wait for it to clear up. Let it get checked. It might not be your eyes. It might be your heart. 4. Nosebleeds. Now, not every nosebleed is a sign of trouble, but when they occur frequently and without clear reason, they could be linked to blood pressure spikes. The delicate vessels in your nose can burst under pressure, especially during hypertensive crises. While rare, this can be your body's way of telling you that something's out of balance internally. If you find yourself getting spontaneous nosebleeds more often, and especially if you're also experiencing headaches or dizziness, don't ignore it. 5. Dizziness. Feeling dizzy or lightheaded, especially when you stand up too fast, can mean a lot of things. Dehydration, low blood sugar. But if it's happening more frequently and without a clear trigger, it could be a sign that your blood pressure is either too high or fluctuating wildly. This is particularly dangerous in older adults, where dizziness increases the risk of falls, fractures, and hospitalization. If you've had a few unexplained dizzy spells lately, it's time to take it seriously. The real danger: silent progression. The biggest threat with high blood pressure isn't just these individual symptoms. It's the fact that most people don't experience any of them, and that's exactly why it's so deadly. It's a silent force eroding your health in the background. One day, you're fine. The next, you're being told you've had a heart attack or a mini stroke. The damage accumulates slowly and invisibly. And unless you're actively monitoring your blood pressure, you may not know you're at risk until it's too late. Dr. David Goff from the NIH puts it this way: by the time symptoms show up, high blood pressure has often already caused serious harm. That's why early detection and routine screening are critical. So what can you do? Here's a practical takeaway. Get a blood pressure monitor at home. They're affordable, accurate, and could literally save your life. Know your numbers. Normal is below 120/80. If you're between 120 to 129 systolic, that's elevated. Above 130/80, that's hypertension. If you're over 135/85s and don't feel anything, that's exactly why you should act now. Also, don't skip your annual physical, even if you feel great, especially if you feel great. That's when high blood pressure hides best. Now that you understand how high blood pressure can quietly damage your body from the inside out, the next question is, who's most at risk? Because while hypertension can affect anyone, it doesn't strike randomly. It follows patterns. And if you fall into any of these categories, this message is for you. Let's start with one of the biggest risk factors: age. Once you cross 50, your arteries naturally lose some of their elasticity. They stiffen, and as blood flows through them, it creates more resistance, forcing your heart to pump harder. That's why nearly 70% of adults over 60 have high blood pressure. But here's the twist: it often begins creeping up years earlier, in your 40s or even 30s, without a sound. Next is family history. If your parents or siblings had high blood pressure, your odds rise significantly. It's not just genetics, it's shared habits, shared meals, shared stress patterns. But the good news: genetics load the gun, lifestyle pulls the trigger. Then there's race and ethnicity. African American adults develop high blood pressure more often and earlier in life than white or Hispanic Americans. It's also more severe and less responsive to some treatments. This isn't just biology, it's also due to long-standing disparities in access to care, nutrition, and chronic stress levels. Awareness is power. So if you're in this group, staying proactive isn't just smart, it's essential. Another major player: obesity. Extra weight means extra blood volume and extra pressure on artery walls. The heart works harder, and over time that workload adds up. Studies show that losing just 10 pounds can significantly lower your blood pressure. And what about how you move or don't? A sedentary lifestyle is one of the sneakiest risk factors. If you're sitting more than you're moving, especially if you work at a desk, skip workouts, or rely on convenience food, your circulation slows, metabolism drops, and pressure rises. Speaking of food, let's talk salt. Americans eat more than 3,400 milligrams of sodium per day, nearly 50% over the recommended limit. High sodium intake causes your body to retain water, which increases blood volume and pressure. Even if you don't add salt at the table, it's hidden in processed foods, canned soups, sauces, and snacks. If you live with diabetes, your risk doubles. That's because elevated blood sugar damages blood vessels and makes them more vulnerable to pressure-related strain. In fact, hypertension and diabetes are often called the deadly duo. Lastly, we can't ignore chronic stress, daily worry, poor sleep, constant tension. These things trigger your body's fight-or-flight system. Your heart rate spikes, your blood vessels constrict, and over time, that repeated stress response can lead to sustained high blood pressure. So now that we've covered who's at risk, let's talk about the hopeful part. Because here's the truth: high blood pressure doesn't have to be a life sentence. It can be prevented, it can be reversed. And you don't need to be a marathon runner or a monk to make it happen. It starts at your kitchen table. One of the most powerful tools to control blood pressure: your diet. The gold standard here is called the DASH diet. short for dietary approaches to stop hypertension. It's not a fad or a cleanse. It's a scientifically proven eating plan rich in fruits, vegetables, whole grains, lean protein, and low-fat dairy. What's out? Excess sodium, sugary drinks, red meats, and processed junk. In fact, studies show the DASH diet can lower systolic blood pressure by up to 11 points. That's the kind of drop you might expect from medication without the side effects. Cut the salt. Most people consume over 3,400 milligrams of sodium per day. The recommended limit, 2,300 milligrams, or ideally 1,500 milligrams if you're at risk. That means watching labels, ditching packaged foods, and choosing fresh over frozen when you can. Boost potassium. Bananas, sweet potatoes, spinach, avocado. These foods help balance sodium's effects and relax blood vessels. The more colorful your plate, the better your pressure. Movement is medicine. You don't have to join a gym. You don't even need fancy gear, but if you can walk, you can lower your blood pressure. Just 30 minutes of brisk walking a day, 5 days a week can make a huge difference. Whether it's cycling, swimming, dancing in your kitchen, or following a YouTube workout in your living room, the key is consistency. Exercise makes your heart more efficient, reduces arterial stiffness, and burns off the stress hormones that keep your pressure high. The American Heart Association recommends at least 150 minutes of moderate aerobic activity per week. That's doable, and your heart will thank you. Let's talk vices. Yes, the tough stuff. If you're serious about your heart health, limiting alcohol is non-negotiable. More than 1-2 drinks per day raises blood pressure, especially over time. And smoking, it's one of the fastest ways to damage your blood vessels. Each cigarette temporarily raises your pressure, and over time it causes permanent harm. But here's the good news. Quitting smoking begins reversing the damage almost immediately. Within a year, your heart disease risk is cut in half. Go methadone. And what about the thing we all ignore? Stress. Chronic stress doesn't just make you feel overwhelmed, it literally constricts your arteries, it raises your cortisol, triggers inflammation, and keeps your blood pressure elevated. So how do you manage it? Sleep. Aim for 7 to 8 hours of good quality rest per night. Poor sleep raises your risk of hypertension by up to 40%. Meditation and breathing. Just 5 to 10 minutes a day of deep breathing can shift your nervous system from fight or flight into rest and digest. Apps like Calm or Headspace make it easy to get started. Journaling, nature walks, prayer, whatever helps you slow down, connect, and breathe. Do more of that. Your heart's not just a muscle, it's an emotional organ too. Cret. When lifestyle isn't enough, there's help. Sometimes, even when you eat right, move more, and manage stress, your numbers stay stubbornly high. That's when medication comes into play, not as a failure but as a support system. Common options include ACE inhibitors, help relax blood vessels. Beta blockers reduce heart workload. Diuretics help the body release excess salt and water. Doctors may use one or a combination depending on your age, health history, and how high your blood pressure is. And remember, medication works best when paired with lifestyle changes. They're not an either-or. But how do you even know if you need treatment? That brings us to one of the most overlooked habits of all, monitoring your blood pressure regularly. Hypertension has no symptoms. That's why they call it the silent killer. The only way to catch it early is to measure it. Invest in a home blood pressure monitor or get checked during routine doctor visits. Look for readings below 120/80 mm Hz. If yours is consistently 130/80 or higher, talk to your doctor. Early detection saves lives. So where does this leave us? Well, maybe not where you expected. Because unlike dramatic hospital scenes or the sudden grip of chest pain we've seen in movies, high blood pressure doesn't scream, it whispers. It doesn't knock you off your feet, it doesn't cause instant pain. Instead, it quietly chips away at your arteries day after day. And that's what makes it so dangerous. But here's the powerful truth. Your body has been talking to you all along. And now, thanks to knowledge, you know how to listen. You know that high blood pressure isn't just a number on a screen. It's a signal, a red flag waving behind the scenes, telling you that your heart is working too hard, your vessels are under strain, and your future health depends on action today. Think about it. Over 122 million Americans, that's nearly half the adult population, are living with elevated blood pressure, and many have no idea until something goes wrong. But now you're not one of them. Now you know that heart damage doesn't begin with a heart attack. It begins years earlier, in silence. You've learned how your lifestyle can either be a slow poison or a powerful prescription. That every extra 10 milligrams of pressure raises your heart disease risk, but every healthy habit, every walk, every leafy salad, every deep breath, pulls you back from the edge. And here's the hope. Even small changes create momentum. Even one choice today can protect your heart for years to come, because the sooner you act, the stronger your heart stays. So if this video opened your eyes or sparked that aha moment, don't keep it to yourself. Like this video if you learned something new. Subscribe to Senior Health Source for more heart-smart insights, expert advice, and life-saving strategies, delivered in plain, honest language. And please, share this with someone you care about, a friend, a parent, a sibling. You never know whose life you might save with just one click. Because sometimes, the difference between a heart attack and a healthy future is simply knowing what to look for and caring enough to act. Thank you for watching, and remember, your heart is listening. It's time to start listening back.